You don't need me to tell you, car accidents can be a pain, literally. They can be a traumatic experience, of course, but that pain doesn't have to become permanent. Dr. Rudy Gari from Florida Pain Relief Group joins us now once again to tell us how we need to make sure these injuries don't go untreated. It seems like a simple thing, right? But most people are rushed right to the ER after an accident, aren't they, Dr. Gari? Why is it important for them to see a pain relief doctor as well?
Well, what happens a lot in a car accident is you get what's called a deceleration type of injury. Basically, you're traveling 30 miles an hour and you come to a screeching halt very quickly. So that deceleration type of injury can cause injuries in and of itself. And normally it can be the joints, it could be your back, it could be your neck. And so that injury, again, a lot of what causes the pain is some sort of inflammation that is a direct result of that injury. So we take care of patients that have been involved in motor vehicle accidents, and whether it's a disc herniation in the lower back, in the neck, joint, or wherever that might be. We even have some patients that, that come and see us. And some of those patients, because of a lot of patients that have been involved in car accidents, may have some sort of legal representation.
Sure.
They may not even have insurance. We will even take care of them because of that, and we can work with their law firm if that's what it takes.
Sure.
We just want to make sure that this patient gets better.
Gets better. Now, a lot of times you have a car accident, and you might feel something. You're not really sure if you feel something. How do you know when you should see someone when the pain might just be like a minor temporary pain?
Well, what I tell my patients is if something is not normal, you know it. Go see a doctor. Because it may be something a little mild right now, but it might be something a little deeper that's going on, and we have to at least make a diagnosis, maybe physical therapy or something to make sure that you can get better.
Right.
Back on your feet.
Is it typically, when people come and see you after a car accident, is it a neck injury? I know you mentioned back, but neck is even more prevalent, more than likely, right?
Well, one of the things that we see in car accidents a lot is what's called a whiplash. So whiplash is when the back of your neck hits backwards. And there are these nerves in the back of your neck that can cause a lot of inflammation there, and you get what's called an occipital neuralgia, a really bad headache behind your head. We can help that quite a bit because we just go in there, get the inflammation to go away. There's different types of procedures we can do for that. So the neck injury is common because the head goes back and forth during that car accident.
It makes sense. Now let's talk about prevention, because most people hopefully are wearing their seat belts. What other kinds of things can they do in their car, because you never know when you're going to be hit from behind?
Well, some of the things that they need to be mindful, of course, is, and this, I'm not a driving instructor, but of course, be defensive. Right. If you anticipate something. In fact, there were some cars. I was driving my son's car the other day, and the car started slowing down. So these sensors are actually very helpful right now to try to prevent these injuries. Wear your seatbelt. Make sure that that your airbag is working. Right. And brace yourself. Yeah. If you're about to hit.
Okay. All right. Good advice. Thank you so much, Dr. Gari. Now, you can contact Florida Pain Relief Group to schedule your same-day appointment. You can visit their website, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. Simple as that. Thanks again, Doctor. Appreciate it. We'll be right back with more Daytime right after this.